Hi, I'm Dr. Raymond Douglas of Beverly Hills, California. I'm an oculoplastic and orbital surgeon. I often get the question, how can I make my around the eye area appear more youthful and improve my appearance? And this is especially a problem for patients with naturally prominent eyes. And a large portion of my practice deals with patients who have naturally prominent eyes and how to improve the appearance. Well, I've created an algorithm for how to approach this for individual patients. And I think it's really important that you see an expert who does this type of surgery all the time and offers more than one solution. And we'll show you a series of before and after photos and how this can be done. But the most important thing is it's a stepwise process in thought and really requires a very thoughtful communication with your physician over probably an hour or two, discussing all the options that you have, because there are quite a few. So patients with prominent eyes have a very advanced way of aging. In fact, they age a little more rapidly than the normal population. You start to see lower eyelid bags, you start to see the upper eyelids hanging a little bit more. And so the aging changes are far more apparent in someone whose eyes are a little more prominent than if you have deeper set eyes. So they often seek my care a little bit earlier in life. They tend to be slightly younger than the average patient and have a little bit more fluid or fat underneath their eyes and are wondering what they can do. And frankly, conventional surgery or a standard blepharoplasty can often be the worst thing you could possibly do. Just removing fat or removing tissue will create a very unappealing result. In fact, it can give almost a frog-like appearance and unmask the eyes and dramatically change what your appearance was or should be. So I take an approach. At first, we start with, well, should we reverse the prominence of the eye, even if it's a little bit? Should we, in essence, move the eye back into a slightly better position? This can be done through a very little incision inside the eyelid, no skin incision, and removing a little bit of fat, or even just expanding the orbit, which is the part behind the eye, just a bit. And this can be done and then allows the eye to move back just a little bit and creates a much easier situation to deal with and a much more appealing periorbital area. And so this really can reverse the natural aging process. It also eliminates the lower eyelid bags for many patients. Many patients are born with very small cheekbones, and this really is very difficult to overcome without moving the eye back or building up the midface. So that's the second option that we often have, is building up the midface, or this mid area right around the nose, the cheek area. And we can do that with fillers in the office in a few minutes, or we can do that with fat. And even in some severe cases that you'll see, we've even done that with implants. But it's the combination of building up the cheek, moving the eye back, that really gives the best aesthetic result, as I think you can see from our before and afters. In the next segment, I'm going to talk about what you can do around the other parts of the eye, the upper lid, the lower lid, and even the lower face. If you like this content, please subscribe to our YouTube channel.